Isang malusog at mapagpalang hapon po sa lahat ng nakasubaybay ngayon sa ating Kapihan with Media via DOH Facebook at YouTube pages saan mang bahagi ng ating bansa. Higit na masarap ang kape sa hapon kung may kwentuhan at kaalaman. Ako po si Nino Angelo de Villeres mula sa Kagawaran ng Kalusugan at makakasama niyo po ngayong hapong ito para sa isang mahalagang diskursong gigising sa isip at kamalayan. Pero bago po tayo opisyal na magsimula, let me just read the house rules. First, use the naming convention below for the Zoom username to ensure proper acknowledgement. Also, we request everyone to pay attention to the discussion of our health experts and resource speakers. Keep your microphones muted while speakers are discussing and presenting. And should you have questions, participants should signify and send them in the Zoom chat box and wait for the host to acknowledge them. There shall be an open forum after the discussion po, but we will address first the submitted questions to our expert followed by the Zoom chat box questions po. And we also encourage every participant and sa lahat po ng nanonood ngayon sa ating Facebook at YouTube pages to reserve questions. And please take note po that only related to the topic being discussed will be entertained. And syempre, huling paalala po para sa lahat, samahan niyo po kami hanggang matapos po ang ating kapihan session for today. This February po, we are observing the National Cancer Awareness Month with the theme Close the Care Gap. So National Cancer Awareness Month po is observed annually every February with the aim of raising awareness about cancer and its early detection. Ang inisyatibong ito po ay naglalayong i-educate yung publiko at i-educate ang publiko about cancer awareness and its risk factor while encouraging people to take proactive steps towards prevention and early intervention. Lingid po sa ating kaalaman, cancer is actually one of the major public health concern in the Philippines with an estimated 141,021 new cases and 86,337 deaths recorded in 2020 according to the Philippine Cancer Society. Ilan po sa mga most common cancer sa Pilipinas ay cancer sa lungs, breast, colorectal, liver, cervical, and prostate cancer. Kaya naman po, ang selebrasyon ng National Cancer Awareness Month ay nagsisilbing paalala sa bawat isa na we can take charge of our health and well-being. It provides us an opportunity for healthcare professional, cancer survivors, and patient advocates to come together to share their knowledge and experiences, raise awareness, and support those affected by cancer. Ang Kagawaran po ng Kalusugan ay nakikiisa sa selebrasyon ng National Cancer Awareness Month dahil mahalagang magkaroon ang publiko ng sapat na kaalaman tungkol rito at para rin po maging responsive tayo at naaayon ang pagtugon natin sa sakit na ito. Kaya naman po ngayong araw, ating aalamin at malalaman ang mga bagay-bagay tungkol sa paksang cancer kasama ang ating mga espesyal na panauhin na handang magbahagi ng kanilang mga kaalaman tungkol rito. At hindi ko na po papatagalin pa, let us welcome the head of the Southern Philippines Medical Center Cancer Institute and a member of the National Integrated Cancer Control Council. We have with us Dr. May Concepcion Dolendo. Magandang hapon po, Doc.
Magandang hapon sa lahat and thank you very much for inviting me to this Kapihan. And we know that February is Cancer Awareness Month. So medyo marami tayong talakayin with regards to about cancer, not only cancer in adults, but also in children. So I'm a pediatric oncologist and but I head the Southern Philippines Medical Center Cancer Institute. And of course, I represent the Philippine Society of Pediatric Oncology at the National Integrated Cancer Control Council. I'm one of the 5 non-ex officio members of the Cancer Council. Next slide, please. This February, among the very important milestones is World Cancer Day. So 2 days ago, February 4 is World Cancer Day, and it's an international day that was marked to raise awareness on cancer, to encourage prevention of cancer, detection, and treatment. So this celebration is observed by the United Nations and is led by the Union International for Cancer Control. And if you can see on the right, that is the map of all the activities that occur during World Cancer Day. So we look forward to this day where we can share our activities related to cancer. And in the Philippines, February is also Cancer Awareness Month. And it is provided in Article 4, Section 16 of RA 11215. We call this the National Integrated Cancer Control Act, or the Philippine Cancer Law. February is the Cancer Awareness Month, and throughout the country, we celebrate this to intensify cancer awareness campaigns. And basically, the reason for cancer awareness is to increase cancer literacy and understanding of the many risk factors associated with cancer, to dispel myths and misconceptions about cancer so that we could reduce the anxiety, fear, distress, and uncertainty that is related to cancer. Whenever we hear cancer, we always think it's a death sentence, which it's really not, as you will know further on. Next slide, please. And this month, can we go back to the previous slide? And this month, we have two very special landmark celebration. First is the signing into law of RA 11215. The National Integrated Cancer Control Act became a law on February 14, 2019. So it's going to celebrate its 5th birthday next week, and there will be activities here in Davao City to celebrate this milestone. The Philippines has also been chosen as a focus country for the World Health Organization Global Initiative for Childhood Cancer. And as a focus country, we lead Western Pacific region in terms of models of care for pediatric cancer. Next slide. So just a few facts about cancer. Worldwide, we know that cancer is the second leading cause of death. So it's really a very important disease that needs attention. And as infections are being managed or accidents are being prevented, cancer becomes a leading cause of death among many people around the world. And as mentioned earlier by Nino, in 2018, there was about an estimated 9.6 million deaths associated to cancer, and this is about 1 in 6 deaths. The most common cancers in men are lung cancer, prostate cancer, cancer of the colorectal area, stomach and liver cancer, while in women, it's breast, colorectal, lung, cervical, and thyroid cancer. And these are the 5 top cancers among women. So cancer in adults is actually very different from cancer in children. Most of the adult cancers are associated with lifestyle. That's why we have very strong laws against tobacco and against smoking, because most of the adult cancers are associated with smoking or secondary smoking. In children, most of the causes are embryonal. It's multifactorial, not necessarily related to lifestyle, because of course they're still very young, but it's also a significant cause of death among children, with about 400,000 children and adolescents diagnosed with cancer below 19 years old every year. And the most common types of cancer, which are very different compared to adults, include your leukemias, your brain tumors, your lymphomas, neuroblastoma, and Wilms tumor. Wilms tumor is a kind of cancer of the kidney. Next slide. And this is from the WHO country profile way back in 2020. As mentioned earlier by Nino, there are about 141,021 cases of cancer diagnosed in the Philippines. But the most recent statistics in 2020 shows a rise to 153,751 cases of cancer diagnosed in the country in 2020. For men, the most common are cancers of the lung, the colorectum, the prostate, liver, and leukemia. For women, of course, the most common is breast, the cervix, the uterus, colorectum, the lung, and the ovary. So I know that the next speaker is going to talk more about cervical cancer, which is among one of the most preventable types of cancer in adults. In children below the age of 19 years old, we expect about 5,046 new cases of pediatric cancer in the Philippines. And the most common types of cancer that we see is your acute lymphoblastic leukemia, followed by brain tumors, and then Hodgkin's lymphoma. Next slide, please. Now, there are many challenges for cancer in the Philippines. Alam po natin yan. Napakamahal po at napakahirap gamutin ang cancer, not only sa adults, but also in children. Although I would say that pediatric cancer is highly curable compared to cancer in adults. But the most major challenges, maraming challenges, but the most major is really late diagnosis, yung late na natin sila na-diagnose, so they come in late stages of disease. And of course, the high financial cost. No, hindi natin alam kung mamamatay tayo dahil sa cancer or dahil sa cost ng pagpapagamot, pagdiagnose, pagpapagamot sa cancer. And this is shown by for example, breast cancer data show that about 53% of breast cancer patients in the country are diagnosed stage 3 or 4. Ito po ay late stage, no? There are 4 stages of disease in most solid cancers. Stage 1, stage 2 are early stage, and stage 3 or 4 is late stage. This is also the same figures in children. About 80% of the cancers that we see, particularly at Southern Philippines Medical Center Children's Cancer Institute, come in late stages of disease. For adults, also the screening outcomes, particularly in the population, is also not very significant. It's only about 2.2 for breast cancer, and for cervical cancer, I think there's still a lot of room for improvement. Since cervical cancer is highly curable when you see them early. When we also look at baseline, when we started the implementation of the Philippine Cancer Law, only about 16 of the 25 designated cancer centers or access sites were fully functional. Currently, there are about 35 access sites for Cancer Assistance Fund or the Cancer Supportive Palliative Medicine Access Program and the many other facility enhancement program of the government here in the Philippines. With regards to PAFs or population attributable fractions, we see that tobacco is the highest risk for cancer among Filipinos. And there's also infections and, of course, alcohol, which is among the top 3 risk factors for cancer in adults. In children, the causes or the causes of cancer is multifactorial. This could be genetics, environmental exposure. Yung mga pasyente na may Down syndrome, they are most likely to get leukemia compared to patients who do not have Down syndrome. Next slide, please. And just to show particularly for cancer in women. This is the Women's Cancer Country Snapshot for the Philippines. In terms of breast cancer, dito nakikita natin that the incidence of breast cancer per 100,000 population, this is 2020 data, in the Philippines is actually much higher compared to Asia and even worldwide. No, it's 52.7 compared to Asia, which is only 36.8. With regards to mortality, mataas din yung mortality natin. This is basically because our patients come in late stages of disease. No, in the Philippines has 19.3 compared to world mortality, which is 13.6. And the cumulative risk of breast cancer below 74 years old is also higher, slightly higher in the Philippines compared to world statistics. In terms of cervical cancer, and this is 2020 data, we also see that the Philippines has a higher incidence compared to Asia and the world, a higher mortality, slightly higher mortality rate, as well as cumulative risk for cervical cancer. And when we look at the metrics on in terms of domains in our scorecard, we see that in the Philippines we're doing quite well in terms of prevention and screening. I think among the strengths, and we don't only see this in women cancer. I think even in other types of cancer we also see this. Although in children we cannot prevent childhood cancer. What we could do is we could do early detection. So for prevention and screening, as well as awareness and education, I think we're doing very well. But there's still a huge gap, or there is still a huge opportunity for improvement to policy and planning, for diagnosis and resource capacity, as well as treatment and access. But when this data was presented to us, I told them that, this is 2020. We already, in terms of policy and planning, I think the NICA Council, we will present the framework for the strategic map in cancer control next week. So hopefully this will also turn green soon. Next slide. So what are the early warning signs of cancer in adults? As mentioned earlier, cancer in adults, in terms of location, in terms of type, is very different compared to the kinds of cancer that you see in children. And commonly, the cancer that you see in adults are medyo slow-growing siya. The cancer in children are very aggressive. A matter of weeks, a matter of months, you will see patients already in late stages of disease. So the presenting features are very different because the types of cancers that we see are also different. Like, for example, unexplained changes. So for example, any lump or swelling. Ito yung mga early warning signs, no? Pag may mga bukol ka dyan, whether it is benign or malignant, it really warrants to be seen. And lalo na pag itong mga klaseng bukol is mabilis lumaki. So this has to be consulted, no? Bleeding that is not normal for you, no? Like pag inubo tayo, hindi naman normal na nagkakaroon tayo ng dugo, no? Sa plema natin. So it's something that warrants further investigation. Lalo na pag umiihi tayo ng dugo, o kaya when we're passing out stools that have blood in it, or kung hindi naman tayo nireregla, nagkakaroon tayo ng bleeding in between, well, it does not necessarily mean that this is cancer. What it means is just basically we have to seek consult. Ito namang weight loss, kung hindi naman intentional, hindi na naman tayo nagpapa-weight loss and bigla tayong pumayat. I think this can be a cause of alarm, and particularly if it's very big, like you lose half of your weight in a month or in a few weeks. This is very troubling, and a consult should be done. Pain that does not go away. if you feel any pain in the abdomen or in your breast or anywhere, any part of your body, and this is more than 4 weeks, and there is no specific reason for the pain, then we have to consult a doctor so that we can see if there is something wrong early. Next slide, please. So unexplained changes, persistent changes, or unusual changes. For persistent changes, a cough that changes your voice, or you feel short of breath, no? Pag halimbawa medyo matagal na tapos nahirapan kang huminga and you have voice change or umiiba yung boses mo. I think this needs to be consulted. Pag may mga sugat tayo na hindi gumagaling despite halimbawa mayroon na tayong ginagamot naman natin, or for example nag-a-antibiotics na tayo, hindi pa rin gumagaling, this is a red flag. Pag nahihirapan tayo lumunok, no, indigestion or heartburn, these are red flags as well. Or if nagbo-bloat tayo, parang malaki yung tiyan natin, parang may hangin. And this is not really normal. Feeling natin parang palagi tayo may kabag. We just have to get it checked. Or pag meron tayong mga sugat sa mouth or in our tongue na matagal na, no, na hindi, it progressively enlarges, this warrants further investigation. Also, when we have changes in our toilet habits like constipation or diarrhea or problems in passing urine, pag meron tayong mga mole or existing mole na sa tingin natin parang umiba ang kulay o kaya lumaki, no? Or if you I think it should be a habit for women to regularly examine their breasts, no? Usually kasi may mga ano tayo pag medyo let's say more than 40 na, but what we are seeing now is we see cancer in the younger patients. So I think this has to be a regular exercise for women when you take a bath, no? Sa Latin ang breast natin to feel if there is any unusual masses. Next slide, please. And so those are the early warning signs for adults, for cancer in adults, no? Does not necessarily mean that when you see those signs and symptoms na immediately cancer yan. Of course, you need to consult a doctor, and halimbawa, if there is concern na maybe malignant siya or cancerous siya, then it might necessitate further workup. But a doctor will be the one to determine whether it needs further investigation or not. Now, in children and adolescents, the kinds of cancers that we see are very different. For example, pag halimbawa namumutla o kaya may bleeding, may mga pasa-pasa, no? Or there's general bone pain. Usually these are early signs, lalo na pag medyo matagal na, and they are seen all together and this takes a few weeks, then this warrants concern. Yung mga bukol, whether in adult or children, hindi common yan or hindi siya karaniwan na nagkakaroon tayo ng mga bukol sa katawan. So particularly if they are painless, no, and medyo malaki. Paminsan-minsan yung mga lusay, yung mga lymph nodes, if they're more than 0.5 or 1 centimeters, and you see them in areas that you don't normally see them, then we need to have it checked. Again, unexplained weight loss or fever, persistent cough or shortness of breath, and sweating. This is sweating at night. And then eye changes, yung puti sa mata, particularly parang cataract, but you see them in the very young children, particularly those below 3 years old, and you see this white pupil. This warrants further investigation. When there's visual loss and where there is bruising or swelling around the eyes, we need to work up this patient. Next slide. abdominal swelling, no? Kagaya nung sa adults earlier, yung abdominal swelling in children. Sometimes kasi karaniwan naman talagang parang malaki yung tiyan ng mga bata, but uh, when the tummy is big and it's getting bigger, kailangan i-examine ng doktor sa Latin kung merong bukol or there is anything abnormal inside the abdomen. Yung sakit sa ulo, lalo na if this is accompanied by vomiting in the early mornings, or it is very, the headaches are severe that it wakes the child, and it is persistent, we need to see a doctor for this. Limb or bone pains, particularly in the adolescents, or swelling without trauma or signs of infection. So ito yung mga bagay na kailangan tingnan natin sa mga bata, so that we could screen whether these are malignant in nature or not. Because early detection is very crucial, particularly in providing better outcomes, not only for children, but also for adults. Next slide. Now, ito yung this is I like this slide a lot because we know that cancer, kahit saan man na bansa, whether nasa Amerika or dito sa Pilipinas, napakahirap talaga siya because it's the disease in itself is difficult. The treatment is expensive and long term. So ang dami talagang challenges. And among the strategies that was suggested by the World Health Organization is how do we set priorities and how do we invest wisely while providing care for all. So it's not just achieving universal health care for every Filipino, but also Filipinos with cancer. So priorities like strengthening tobacco control, because we want to prevent cancer. We don't want cancer to happen. So, and we know that tobacco or smoking has been associated with many kinds of cancer. There are preventable cancers such as, hepatocellular carcinoma, liver cancer. When you give hepatitis B, there's this big study in China wherein they had a very high incidence of hepatocellular carcinoma, but when they institutionalized hepatitis B vaccination in very young, they were able to decrease the incidence of hepatocellular carcinoma. And also human papilloma virus, HPV vaccination, which prevents cervical cancer. Screening for cervical cancer, because it's quite simple and it's curable when you see it early. To focus on early diagnosis and treatment for curable cancers, childhood cancer, for instance. Scale up the capacity to manage more patients in the next decade or more, and to provide palliative care for patients who may not be able to survive cancer. And we will be launching the Philippine Strategic Framework next week during the 5th anniversary of the National Integrated Cancer Control Act. And if you can see, the strategic focus of the Philippines is on health promotion and cancer prevention, early detection, timely diagnosis and prompt treatment of cancer patients, increasing treatment completion and improved survivorship care. Kasi naman, hindi lang naman yung naumpisahan natin gamutin, tapos hindi natin natapos. This decreases the chances of survival very much. And to reduce the financial burden across the continuum of care. So, hindi lang during diagnosis and treatment, but also in health promotion, during screening, prevention, diagnosis, treatment, survivorship, and even end of life. Next. And what I'm very, very happy to show are the gains that we have had in the past 5 years with the implementation of the NICA law. And this is also to be taken in the context that of this 5 years, 2 years of this is COVID. So there has been considerable delay because resources have been provided. The focus of the country has been focused on COVID, but now we are able to do lots of things, particularly for cancer, because COVID did have an impact on cancer because patients cannot go to the hospital. A lot of patients presented with late stages of disease. So if we look at the different articles in the NICA law, the following have been implemented. For example, for Article 2, which was the National Integrated Cancer Control Program, among the countries in the Western Pacific area, I think we are the one of the few or even the only one with a law and a cancer control program that is embodied in the law. We're also very happy that the National Integrated Cancer Control Council was put together to look into the implementation and to provide policies that are favorable for cancer patients. And we were able to come up with a roadmap as well as a strategic framework, which for the next 5 years that we are going to present next week. The creation of the Cancer Control Division under the Department of Health, I think, is a very important milestone for the NICA law. Crafting of several clinical practice guidelines, not only for childhood ALL, Burkitt lymphoma, Wilms tumor, retinoblastoma, but also for thyroid cancer, for breast cancer. These are very important, particularly if you're considering evidence-based treatment as well as costing of care for the different types of cancer. Of course, cancer prevention and screening or early detection. For quality healthcare systems, now we have 35 designated cancer centers across the country. It used to be that people would have to fly to Metro Manila to get treatment for cancer, but now things like breast cancer or colorectal cancer can be treated at the designated cancer centers across the different regions. And of course, the Philippine Cancer Center, which is now starting as a management office, and then hopefully in the next few years, we would have our own Philippine Cancer Center, which will take care of the very rare and very difficult cancers. Licensing requirements, we have already crafted this, multidisciplinary approach to cancer diagnosis, referral pathways and health systems, and the education of healthcare workers and allied services. Cancer awareness, this is why we have February as Cancer Awareness Month. And not only in the communities, but also in schools and workplaces. A lot has been done, particularly in making cancer care and treatment available to those who already have cancer. For example, we're trying to look again into the PhilHealth Z package and see how we can improve and include more cancers into the PhilHealth Z package. The Cancer Assistance Fund, which has helped considerably many indigent patients across the country. And I think one of the very important milestones is providing PWD for cancer patients, not only for adults, but also children who have cancer. And the Cancer Supportive and Palliative Medicine Access Program under Essential Medicines of Article 6, Article 7, PWD privileges for cancer patients and survivors, as well as DSW social welfare benefits. And of course, among the things that we are doing is the population and hospital-based cancer registry, because we want to craft policies that are based on data. And there is only one very important population-based registry in the country, which is Rizal, which is in Rizal. And now we want to do this in the Visayas as well as Mindanao. Finally, my last slide. So, second to the last. So these are the cancer services. So we have classified cancer treatment facilities according to functions, and we have designated specialty centers in cancer care across the country. We have, of course, we have designated the Philippine Cancer Center as the National Specialty Cancer Center, and then we have advanced comprehensive centers that is being developed by the Department of Health, being enhanced to be able to deliver the kinds of services that are necessary. And then also the basic comprehensive cancer centers. And we have added more from the baseline of 25 to now we have 35 access sites across the country. Next. And finally, the Philippines, through the NICA law, global collaborations, and multi-stakeholder participation, has made significant strides in the battle of cancer. And this cancer fight is not very simple because it spans across various fronts, from prevention to early recognition, timely care access, treatment completion, survivorship, and even end of life for both adults and children. But I would like the public to have to seek and have a deeper understanding of cancer, while exploring what resources are available, because there are many resources available for cancer, and to actively not only to partake but also to actively contribute to the ongoing fight for cure and improve quality of life for cancer patients in the country. Now, this is my last slide. Thank you very much, and over to you, Ninyo.
Alright, maraming salamat po ulit, Doc May, sa pagbabahagi ng iyong expertise po about cancer. Siyempre po, marami po sa ating mga Pilipino, alam po natin yung sakit na cancer. Alam din po natin na yung sakit na cancer ay nakamamatay, pero meron pa po palang mga bagay na pwede tayong gawin, lalong-lalo na po yung early detection, which is kaya napaka-importante po na hinighlight nyo po yung mga symptoms or signs na dapat maging careful tayo or maging vigilant tayo, para at least po if we experience those signs, pwede po tayong magpakonsulta agad. Kaya sa ating publiko po, wag po tayong matatakot magpakonsulta sa ating mga eksperto. Kasi po tandaan natin, cancer is the second leading cause of death globally. Kaya naman po para sa ating mga publiko, sa publiko na nakaka-experience na ng mga gantong symptoms, lapit na po tayo agad sa ating mga eksperto. Tandaan po natin lagi na prevention is better than cure. Ayun, kaya naman po, after that enlightening presentation on cancer awareness, the policy, and prevention, pag-usapan naman po natin ngayon ang isa sa mga uri ng cancer na very common sa mga Pilipino, lalong-lalo na or particular na po sa mga kababaihan. At upang bigyan po tayo ng dagdag kaalaman, kasama natin ngayon ang Head of Department of Obstetrics and Gynecology of UER MMCI, an Associate Professor too from UER MMCI din po, College of Medicine, and the Chief for Section Gynecologic Oncology and Trophoblastic Disease ng Jose R. Reyes Memorial Medical Center, and the past President po of the Society of Gynecologic Oncologies of the Philippines. Wala pong iba kundi si Dr. Lily May Cole. Magandang hapon po, Doc.
Magandang hapon. Maraming salamat ninyo. No? So, thank you, Dr. Dolendo, for that intro. It makes my talk easier. No? So, I was asked to share with you information, no, about cervical cancer. So I would like to thank this opportunity for the Department of Health, no, for giving us this opportunity to share our advocacy at Jose R. Reyes Memorial Medical Center. So it has been mentioned, no, this came from the WHO website. Actually, 30 to 50% of cancers can be prevented. And these risk factors were already discussed. So tobacco, smoking, alcohol, physical inactivity, dietary factors, there are a lot of them. This will entail another talk about the dietary factors, but all this information are available in the internet. Obesity, infections, environmental factors. If you will notice, no, most of these risk factors are lifestyle, something to do with the lifestyle. So, very important, no, that we spread cancer awareness, no, and it has been shown to be the key to early detection and the better health-seeking behavior, no, for the people. So, health-seeking behavior is a very important problem in our country. No? I've seen a lot of patients seeking consult when the symptoms are already in its disseminated or in its advanced, and when the cancer is already in the advanced state. No? So the reality is there is poor awareness, no, in our country with regards to cancer, even all types of cancer. If there is no awareness, there is no knowledge, no, about how we contract the disease or what the symptoms are. So there will be poor uptake of the screening modalities. No? Mind you, screening modalities, especially for cervical cancer, is very much available. It even has been made available in some low resource areas. No? And if there is poor uptake of the screening modalities, there will be delay in diagnosis. So when there is delay in seeking help for cancer-like symptoms, we see patients who are in the advanced stage, no? As was mentioned by the previous speaker. And if it's in the advanced stage, realistically, what we can offer is already only palliative treatment. No? So cancer attitude is very, very important. No? And this is the reason why cancer is now it's, I heard from Nina, second na pala, no, leading cause, no, of mortality, no. So if we will look at the data, no, there is low cancer prevention consciousness among us, and the data shows that for every 3 new cancer cases diagnosed annually, 1 will die within the year. So that just confirms, no, the reality that we see them in the advanced stage. So again, from the data, 7,800 plasma cervical cancer cases are diagnosed annually. And it is the second leading cause of female cancer in the Philippines, next to breast. And it is the most common in the 15 to 44 age group. With regards to cervical cancer mortality, out of the 7,800, half of them will die from the disease. That's why cervical cancer ranks as the 4th leading cause of cancer death in our country. And again, in the age group of 15 to 44, it is the 4th leading cause of cancer death. So 15 to 44, this is a very young age group. They are in the very productive, very productive times in their lives, no? And these women would have children, no, that they will leave behind. So very, very important that we are conscious, no, of our reproductive health. So in Jose Reyes, these are the number of cases, no, of new cases of cervical cancer that we see every year. So it ranges, well, during the pandemic, it went down to 139, 186, but it has been slowly picking up again. People are going to our center, no, for treatment of cervical cancer. And if you will look at the stage, no, so this is the stage, this distribution of the cases that we see. Overwhelming majority would be at the stage 3B. So stage 3B is considered a late stage, advanced stage of the disease. This is also the outcome of this cervical cancer cases that we see. So last year, only 40% were having treatment, 18% have completed the treatment. And if you will look at the data of the loss to follow-up, that is 6%. No? There was a time that the number of women, no, that were lost to follow-up were about 50%. So I think there is improvement, but it is not enough. No? So the key is really to get them pre-malignant, no, before the cancer starts, because the treatment is very, very simple, unlike the treatment for those with overt cervical cancer. Okay, so when we treat cancer, no, in our center, this is the regimen that is usually used. No, surgery is offered for early stage disease. No? So very early cervical cancer and the pre-cancers are with completed family size. They undergo hysterectomy, early cancers that is resectable undergoes radical hysterectomy. But the standard of treatment, knowing that we usually see them way past the operable stage, is the combination of the following. So there is an external beam radiation therapy, and this is given daily, usually for 28 sessions. And they are given weekly chemotherapy, outpatient only for 6 cycles, and this is followed by the brachytherapy. So this poses a lot of demand on the resources of the family. They have to go to those areas for the treatment every day, and some of them are from the nearby provinces. So it really takes up a lot of the resources of the family and the patient. So just to make clear that we know what we are talking about, when we say cervix, it is this part, So this is the vagina, and then this is the cervix. The cervix is actually part of the uterus, So the whole uterus, this part, the lower part, is the cervix. And this is the one that is referred to as kwelyo ng matres, Siya rin yung bumubukas pag nanganganak. So sinasabing 3 cms na, 8 cms na. So siya yun, it's a very, very seemingly small structure, However, it is the most common gynecologic cancer. So you have this, the fallopian tube and the ovary. So this is the endometrium. So if cervix is the number one, the gynecologic cancer. The second is ovarian cancer, followed by endometrial cancer. Fallopian tube, vagina, and vulvar cancers are rare. So ito siya, if we highlight, so usually, we use the speculum to look at the cervix. And this is a normal cervix when you see it. And sometimes we see overt, fungal or a tumor that is cauliflower-like already, because patients would come in already with bleeding. So what are the risk factors? Why do these women develop cervical cancer? So these are the identified risk factors for cervical cancer. Early age, at first, sexual intercourse, having multiple sexual partners, having many children. Smoking is also a risk factor. And then sexually transmitted infections. So in fact, the cause of cervical cancer is a viral sexually transmitted infection. And then long-term use of oral contraceptive pills. So ito yung culprit. It has been identified. It has been well studied. So there's really no reason why we cannot control cervical cancer because the cause has been identified. So there are several types. In type 16 and 18 is said to cause the 70% or majority of the cervical cancer. There are other 12, 13 types, high-risk types or carcinogenic types. They are less virulent than the 16 and 18. And it has been known that the incidence rises steeply at age 35. So the reality is, it is diagnosed in the late stage when patients are really at the prime of age. So this just demonstrates how HPV is transmitted sexually. That's why multiple sexual partners is a risk factor. So tendency is they get it from somebody and they transfer it to another. Mind you, HPV infection is the most common sexually transmitted infection, but not all of them will develop into cervical cancer. So just like any viral infection, it is shed off by the body depending on the immune system of the person. But it is those with persistent HPV infection that we need to see. That is our target population. There are those women who retain the HPV in their cervix, no? And this causes the changes in the cervix leading to cervical cancer. Okay, so this is how cancer is staged, no? Generally, when stage 0, this is pre-cancer. And again, the pre-malignant stage of cervical cancer has been well studied because the cervix is very accessible. We have the lesions known as the cervical intraepithelial neoplasia and the high-grade squamous intraepithelial lesions. So lately, itong H-seal and L-seal or low-grade squamous intraepithelial lesion is the more acceptable term for the pre-malignant. We're doing away with CIN. So when you say stage 1 and 2, these are considered early stages and the chances for cure are high, no? Once they undergo treatment. Stage 3 and 4 are the advanced stages. So HPV or the virus doesn't only cause cervical cancer. It is said to cause other types of cancers, no? 90% of anal cancer, 40% of cancers of the external genitalia, no? So vulva, vagina, penis, so penile cancers are also caused by HPV, 12% of oropharyngeal cancers, and 3% oral cancers. So what are the signs? How do we know that we are possibly having a lesion in the cervix? Generally, especially in the early stages, lalo na yung pre-malignant stages, there are no symptoms, asymptomatic. So this is the best time to do the screening for the asymptomatic women. So once there is bleeding, which is what is known as postcoital bleeding, or having a watery blood or diluted blood, vaginal discharge, and more so if it's already heavy and has a foul odor, no? Sabi nila, cervical cancer would have a distinct smell. Pero yung mga ganito, usually this is associated with huge lesions already, and most probably are in the advanced and late stages. So having pelvic pain or pain during intercourse can also be a sign, low back pain, swelling of one leg. Those are late signs of cervical cancer. So the natural history of cervical cancer, so it's a very slow growing disease, from HPV infection to a frankly invasive cervical cancer. It takes around 15 to 20 years. So there is a lot of opportunity to catch the disease in its early stages, So how come we are getting cases that are already in the advanced stages? And identified problem with regards to this is the women does not seek consult for screening. So what are the screening methods? I'm sure you have heard about pap smear. It has been here for quite some time. It has been effective in developed countries in controlling the disease. But sadly, it wasn't that effective in our country. Some 20 years ago, visual inspection with acetic acid was introduced. And lately, this is the latest, the latest player in screening, and which was found to be quite effective, is the HPV DNA testing. So pap smear, it has been here since the 1920s, when these pathologists discovered that you can scrape the cells out of the cervix, and when you look at the microscope, you can see the abnormal cells. The problem with pap smear is you need a pathologist to read the result. And it is usually masked by other conditions, like for example, infection, menstrual blood. You cannot do conventional pap smear if there is menstrual bleeding. And that is why it is done when you do conventional, meaning the smear is what you see on the left side is smeared on the glass slide, and seen by the pathologist. lately, no, so hindi na rin naman very recent would be the liquid-based pap smear, which is more effective because it washes away the artifacts and the inflammatory. So, bakit siya hindi effective? If you will look at some women, they had the notion that having a pap smear ay nalinis na yung mattress nila. They look at it as a procedure that would make them infection-free or disease-free, no? And some of them would not really come back. So may problema rin with counseling. So it has to be well explained that pap smear is a screening strategy and they need to come back for the results. So yun ang naging problema with the pap smear. And in the remote areas na walang mga pathologists, no? So that's why this has not been a very effective screening method. The next one is the visual inspection with acetic acid. Well, this has been recommended before. There were a lot of programs, no? It was disseminated. Midwives and barangay health workers were trained, no, how to do this because it only needs your kitchen vinegar or acetic acid, 5%. You just wash the cervix, so it turns white. No, if it turns white, it is actually linked to treatment. So, ang problema kasi with the screening is hindi sila bumabalik after the screening. So, in this case, no, you have a captured patient. So, pag nag-white, it is you do your cryotherapy. So, just to make sure that if ever there is a pre-malignant lesion, cryotherapy is a treatment for pre-malignant lesion. So, it was it was covered by the cryotherapy. But problems arose also with cryotherapy, especially in the remote provinces, no, with regards to the supply of the carbon dioxide, no, kasi it is contained in a tank na napakabigat, no. So kahit na there are skilled healthcare workers, kung wala yung equipment and the supplies, well, it will not be very effective. So that is what happened to VIA. But mind you, we are still doing all these tests, no? Even the conventional pap smear and the VIA, they are effective, no? As long as we know how to handle, no? What to do in women with showing up with abnormal results. So lately, no, the WHO had a call to action, no? And what has been recommended is an HPV DNA testing. So the test is very similar to the liquid-based, no, pap smear. Ganon yon, no? And the beauty of this test is there is an option for self-collection. So there is a thinking that some of these women are ashamed to lie down and open up their legs, no, for the healthcare worker to collect the specimen. So there are training. So since 2020, there is an NGO, the Success, no? They did a test, no? I think we were able to come up with 40,000 tests. And it has been shown that this has been an effective, no? Screening test. So why am I saying that? Since we are one of the sites for Success, and we have a section established, no? Section for gynecologic oncology. We are now seeing a lot of pre-malignant lesions, no? As we see that those that turn positive with HPV DNA testing, we perform the treatment for them. So again, the beauty of the HPV DNA testing is that if it's negative, you are assured, no, that you will not get, no, cervical cancer in the next 5 to 10 years, provided that your partner is monogamous, you are monogamous, no. So as long as if there is a new partner, no, you cannot have that assurance. No? So we start the test, no, at age 30 and usually stop at age 15. So bakit ganon? because as I mentioned before, HPV infection is very, very common. And usually in young patients, no, if ever they will contract HPV, high-risk HPV, usually the immune system is quite high and they usually shed it off. So we watch out for those women who are 30 and above and still have are still positive for HPV. So these are the ones who are likely to have persistent HPV infection. For women living with HIV, so because of the compromised immune system, the screening would start at age 25. So you will see this in the Omnibus Health Guidelines for Adults of the Department of Health. No? The target population for screening for cervical cancer is 30 to 65. And these are the special populations. No? Women living with HIV, commercial sex workers, and those with diagnosed with other diseases, what would make them immunocompromised. So all these screening methods are recommended, no? Both the cervical cytology or the pap smear, VIA, and the HPV DNA testing. So in our center at Jose Reyes, all services, no, for the treatment of pre-malignant lesions are available. We have charity services. Our equipment, our machines are top of the line. This is the colposcopy machine. And one of our fellows is doing the cryotherapy. No? We also have thermal ablation. And this is a recent player, thermal ablation, because as I mentioned before, wala yung malaking tank, no, that you need to bring. Because all are portable, no? We bring this to our medical missions and screening missions, no? Yung lip, this is a special wire loop, no, that removes the pre-malignant lesion. Conization, we use the knife to remove the lesion and up to hysterectomy. So all these services are available at Jose Reyes. So this is the complete guide to the services that are available. Charity services, these are usually free, though taken care of by PhilHealth, and if not by the social service. So not only, no, for cervical cancer, but other diseases that would make them immunocompromised. So we have an STD clinic, family planning clinic, reproductive health clinic. So hindi lang yung family planning, also those with infertility and all other services. Okay, so as of now, being one of the sites for success, no, you still do free HPV DNA testing. The study will be closing March 31. So for those who want to avail of free HPV testing, you can proceed to the oncology, no, onco OPD. It's known as onco OPD, and our custodian and nurses will be entertaining you and will be teaching you how to collect the specimen if you prefer the self-collected. Oh, so that is my last slide. Thank you for listening and I welcome all your questions.
Okay,
you.
maraming salamat po, Doc Lily, sa pag-share po sa amin ng mga bagay patungkol po sa cervical cancer. Kasi katulad nga po nung sinabi nyo kanina, cervical cancer is actually the second leading type of cancer among women's after po ng breast. So napakahalagang impormasyon po nito, lalong-lalo na po sa mga kababaihan natin. Kaya sa ating publiko, particular na sa mga kababaihan, ulit-ulitin po namin mula sa kagawaran ng kalusugan na napaka-importante po ng early detection. Meron po tayong mga libreng screening. Kaya wag na wag po tayong mahihiya or wag po tayong mag-hesitate na magpa-check at lumapit po sa ating mga eksperto. So it is clear that knowledge is our most potent weapon in the fight against this silent threat. So lagi natin tatandaan na it's not just about understanding the risk po. It's about taking proactive steps to protect your health. And our speakers po, binigyan po nila tayo ng mga kaalaman at tools po. And now, it is up to us po to be the ambassadors of awareness and prevention. Sa puntong ito po, tutungo na po tayo sa ating Q&A portion. So these questions po were submitted in advance. And to our media partners po, if you have further questions, kindly send them in the Zoom chat box below po, and we will try to accommodate them as much as we can. And so, may unang question po tayo dito. Ang unang question po natin ay mula sa ating media partner, Merlina Hernando Malipot from Manila Bulletin. This question po is for Doc May. Doc May, ang question po nila ay, what are the most common types of cancer in the Philippines and what are their risk factors? I believe nabanggit na po ito kanina, pero kahit short reiteration lang po, Doc.
So, for men, ang top three siguro na most common, of course, is lung cancer, followed by prostate cancer and colorectal, no? Colorectal cancer. For women naman, ang top three natin is breast, and then colorectal cancer, and then lung cancer. So, kung tingnan mo sa top three, both men and women, nakikita natin, di ba, ang lung cancer is number 1. So, ito naman is really, ang risk factor nito is smoking. That's why the country is trying to have very strong regulation or laws against tobacco smoking and then smoking. I come from Davao, and dito po matindi talaga ang no smoking dito. Sa eroplano pa lang sasabihan ka na huwag ka mag-smoke dito, no? So, ito yung mga things that helps. And the other is lifestyle, of course, no? Obesity, drinking alcohol, no? Ito yung mga risk factors that contribute. Kasi ang isa sa mga things nito is alam naman natin that anong pinaka-protection ng body against cancer? It's actually our immune system. So, itong mga things like smoking, itong mga lifestyle na hindi tayo nagre-rest, umiinom tayo magdamagan, o kaya manigarilyo tayo ng 3 packs, no? They actually impact on our immune system. And when our immune system is weak, no, this predisposes to the causation of cancer in adults. In children naman, multifactorial. Ang pinaka-common dito is leukemia, right? Acute lymphoblastic leukemia, followed by brain tumors and then lymphomas. So, maraming causes as mentioned before, no? Pwedeng genetics, no? Genetic predisposition. May mga families pa minsan-minsan na that are higher risk for cancer, lalo na like halimbawa tanungin mo both sides of the family, may colon cancer, may breast cancer, so on and so forth, no? So there's familial tendencies. Yung mga may kapansanan na dati gaya ng mga Down syndrome patients, they are at high risk for leukemia. So, and then of course viruses, no? Yung sinabi kanina ni Doktora, we see patients below 19 years old, pero so far yung mga cervical cancer binibigay namin yan sa mga gynae-onco, mas alam nila yan sa amin, right? Kami napaka-inosente. We don't sometimes even forget to ask about sexual history sa aming kasi syempre isip mo parang below 15 years old, parang medyo naive. But these are important questions that need to be asked, particularly among teens or even young adolescents.
Right. Maraming salamat po, Doc, sa pagsagot po ng question. Our next question po is for Doc Lily. Doc Lily, ang question naman po na ito ay from Zakina Elise Espina of Manila Bulletin. So, ang question niya po, what are the risk factors for developing cervical cancer and how is it diagnosed? So, I believe na banggit nyo na rin po kanina, pero onting reiteration lang rin po, Doc, para po sa public and para po sa question ni Ma'am Zakina.
Yeah, oo. No worries. Gustong-gusto kong ulit-ulitin yan. Just so pumasok sa utak nating lahat. Ano? So, since the cause is HPV, which is a sexual transmitted infection, yung mga risk factors are related to sexual intercourse, no? So, early sexual debut. Ang tawag namin sa age at first sexual intercourse. Ang may mark would be sexual intercourse, no? At age 14 years old and below. No? So, multiple sexual partners. So, I've mentioned, no, since this is a sexually transmitted infection, napapasa-pasa siya. No? So, kung maraming sexual partners, there's more chance of contracting the disease. No? smoking, no? Yung smoking per se, yung chemicals niyan is a carcinogen, ano? So they have been found in the mucus, no? Yung mucus sa cervix. So we call them cofactors, eh, no? So pag nagkaroon kang HPV infection, the chances that you will have other sexual transmitted infections is also very high. And we call them cofactors. So yung mga chlamydia, yung nagkakos ng pelvic inflammatory disease, gonorrhea, mga cofactors yan. It also lowers the immune system. So kung merong HPV dyan na supposedly na shed off, no? So nag-stay siya, no? Stay siya dun sa cervix, and later on it produces, no? It produces changes in the cervical cells.
Okay, thank you so much po, Doc, sa pagsagot po ng question natin. Another question naman po, again, for Doc May po. Doc May, ang question po ulit, this is from Manila Bulletin po again. How does early detection impact cancer treatment outcomes, and what are the latest advancement in cancer research and treatment daw po in the Philippines?
So actually, number one, ayaw talaga natin ng cancer, right? So kung pwede, wag tayo magkakaroon ng cancer. Sorry, what was the question again? I was trying to.
The question po is, how does early detection
Oh,
impact
okay,
cancer
yeah.
treatment?
Early detection. Yeah, so whether it is adult or whether it is in children, early detection is crucial for people, particularly those living in countries like the Philippines with limited resources. Kasi kung iisipin mo, if you see cancer early, like stage 1 or stage 2, no? Halimbawa, hindi talaga natin na-prevent yung cancer, so nagkaroon siya ng cancer, but it's only stage 1 and stage 2. So sometimes ano lang, no? Surgery lang, no? Kagaya yung sinabi ni Ma'am kanina na you just remove the cancer and that's it. You don't have to do anything. Pero when you see them in late stages of disease, you would need other things like apart from surgery, kailangan ka mag-chemotherapy, kailangan ka mag-radiation therapy, and this entails a lot of cost. So ito yung pinaka-biggest impact ng early detection both in adults and in children, yung cost. Kasi pag simple lang yung gamutan like surgery lang, mas makakocomply tayo, right? Because the key to very good outcomes in cancer is really to complete treatment. No, yung matapos mo talaga. So kung matagal yung gamutan, let's say 3 taon, like for pediatric cancer, paminsan-minsan nag-a-abandon sila ng treatment, right? Babalik sila, nag-relapse na yung disease. You know that for acute lymphoblastic leukemia in children, when you see them in early stage, let's say standard risk, 80% ang survival. If the patient relapses, it's going to be less than 20%. So may malaking impact yung early detection with regards to outcomes. Number 2, ano yung mga researches na ginagawa natin ngayon? When you are living in a limited resource setting, wala kang masyadong magawa in terms of, and I'm talking across the country. Alam ko sa Metro Manila, you are very well developed. You have access to state-of-the-art treatment or even diagnostics, but in the rest of the country, it's very difficult. So a lot of the researches is mostly epidemiological. And I think it's very important to have population-based cancer registries to know, kasi bawat lugar iba-iba eh. Alam naman natin lifestyle, environment, it impacts on the kinds of cancers that we see. Like halimbawa, yung mga populations siguro na malakas kumain ng dried fish, right? So ano yung mga klase ng cancer that they get, or in places na walang masyadong smoking, is there marami bang lung cancer diyan, or wala bang lung cancer because walang smoking? So ito yung mga common things. But apart from that, kagaya sa amin dito sa Children's Cancer Institute, like I'm the primary investigator for Burkitt lymphoma in the Asia Pacific region. Because what we would like to know is ano yung biology ng Burkitt lymphoma among the Asian population. Kasi kung tingnan mo, bakit sa Africa, ang dami nilang lymphoma. Pero dito sa Pilipinas, among Asians, we don't see them. So is there something in our genetic makeup? Is there something in our biology that protects us from Burkitt lymphoma that is different from the Africans? Or kasi itong mga nababasa natin, di ba, Dr. Lily, itong mga nababasa natin, data yan from America, data yan from Europe. We hardly have data for the Asian population, which has an entirely different biology compared to the Caucasians, compared to the Europeans. But also, having said that, what is interesting among Filipinos is melting pot po tayo, di ba? Si Dr. Lily siguro may dugong Spanish yan, or may dugong European yan, may dugong Chinese, no? We're a mix of many genetics. So it's very interesting to know, because biology, I think, is in the heart of cancer. And if we understand this, particularly in our population, then we would know how to address this. Even sa drug sensitivity, bakit tayo mas sensitive tayo sa mga chemotherapy compared to the Caucasians? So ito yung mga bagay na we would like to study more. And what is very exciting, and this is coming because we're going to participate in this, etong being able to diagnose cancers using molecular sequencing or genetic sequencing, right? Kasi kung nagawa natin sa COVID, why can't we do it with cancer? Right? Because if you make the diagnosis simple and accurate, then you can manage it appropriately, and the patient doesn't have to go around looking for the right diagnosis. So ito so far, and I know there are lots of researches, both local and international, that is being conducted in the Philippines. But it has to be, for the Philippines per se, what is important is to look at it in our localized setting.
Right. Maraming salamat po ulit, Doc May, for answering that question. So next question po, another question po for Doc Lily. Doc Lily, parang similar question din po with question ko kay Doc May, pero dito naman po in the Philippines, what are the treatment options daw po for cervical cancer, and gaano daw po ka-epektibo itong mga treatments na meron tayo sa Pilipinas to address cervical cancer?
Okay. So, yun, yung range of doing surgery. Yung surgery kasi for cervical cancer, no? Very, very limited yung scope niyan, no? So, very stringent yung criteria, what kinds and stage of disease, no, can undergo the surgery. Dapat maliit lang siya, no? Less than 4 cms, no? Kasi yung radical hysterectomy, this is a very difficult procedure. Tapos yung histologic type, so dapat yung mga squamous, adenocarcinoma, all the other types that are virulent, usually kahit operahan mo, nagre-refer sila. So the standard is actually yung combination ng chemotherapy and radiation. So yung radiation, no, so very, very sad, ano, pag nakakita ka na, pag narinig yan, no, ng layman, of some patients, no, natatakot sila. There is this belief na kapag nagpa-treat, no, sabi nila lalong lumalala yung cancer. So, ayan, kapitbahay nila kasi kinimo, ayan, namatay tuloy. So, they are associating the treatment, no, with the death, no. When in fact, usually, itong mga namamatay na to would actually be in the very advanced stage, no. And ang truth of the matter is, pag malalang malala na, dyan gustong magpagamot, no. So I've seen patients, no, diagnosed a year ago for early disease of cervical cancer. Hindi magpapagamot. Alam na niya na may cervical cancer. Pero dahil it's early stage, walang masyadong nararamdaman, hindi yan magpapagamot or would go to other types of treatment, no? So pag hindi na masakit na yung tiyan, hindi na makaihi, that's the time that they are willing to undergo the treatment. And this is one of the misconception that I think we should impart, no, to people, no. Madaling gamutin, cancer is curable if it is diagnosed in the early stage, no. So Itong treatment na to, no, it underwent several studies. It has been proven to be very effective in controlling the disease. So, ito yung ino-offer namin, no, aside from surgery, hemorrhagation. We have we have a very top of the state of the art machine, no. Mga recent lang, no. We have the linear accelerator, no. Hanggang image guided brachytherapy, we can do that, no, in Jose Reyes. Ang drawback lang, of course, is we are flooded with patients, no. So yung iba kasi, naiinip sila, no, doon sa pila, no. So for some time, we have 2 months backlog, no, for brachytherapy. Pero unti-unti ngayon, wala na kaming backlog because PGH nag-bag down yata yung brachy nila, no? So yun lang, kailangan tiyagaan natin if we are in the government setup. Talaga pong maraming pasyente, no? We see 40 to 60 patients a day, no? We do chemo of 40 patients a day. So madami talaga yung load, and we only have a number of fellows, no, doing the treatment. So ito pong mga treatment na to, pag sinabi sa inyo ng doktor na ito ang gamot para sa cancer, paniwalaan niyo po. So wag kayong babalik na malala na. So yun yung nakikita nyo na hindi na nagre-respond dun sa chemotherapy at sa radiation kasi malala na, no? Yun lang po.
Ayan, thank you so much po, Doc Lily, sa pagsagot po ng question. Ayan, so ito po medyo parang kadugtong po ng tanong ko kay Doc Lily, pero para sa iyo naman po ito, Doc May. Another question po from our media partner. Nabanggit po kasi kanina ni Doc Lily na may mga haka-haka na mas nakakamatay daw po or nakakalala pag tinitreat natin yung cancer, which is hindi totoo. So, Doc May, ano po ba yung mga some common misconception po about cancer na sa tingin nyo na dapat ma-address para, malaman po ng publiko natin?
Well, una, pag-isipan natin, mahirap talaga ang cancer, right? Pag wala kang, yun na nga sabi ko, I like being an oncologist. Kasi pag alam mo na cancer, parang definite siya, wala kang gagawin, talagang mag-progress siya because that's the natural course of the disease, no? So, cancer in itself is very catastrophic. It will kill you. So, you don't expect na ang gamot dyan is isang linggo ng antibiotics like pneumonia. Right? So, kaya ang na-develop na mga treatment sa ganyan, kasi if you look at the nature of cancer, mabilis siya lumaki, mabilis siya kumalat. So, yung mga surgery, chemotherapy, and radiation therapy were developed basically to deal with this very catastrophic illness, no? You need to kill the cancer cells kasi cancer comes from a single cell. Pag may naiwan na isang cancer cell dyan, tutubo yan siya balik. And so this is why medyo mahirap din. If we're saying na madali lang gamutin ng cancer, I think we'd be lying. Pero ang totoo dyan is, cancer is curable, but the treatment is not easy. Yun kasi ang unang misconception dyan na pag cancer parang wala nang hope. I think that's one. But there are two things that I would like to say. Number one, nung unang panahon, mahirap talaga ang cancer. Ngayon, may mga resources na. And cancer research is the most, ito yung pinaka-active, pinaka-dynamic na area of research. Siguro sa lahat ng medical field. So we know a lot about cancer. We've been studying the treatments for a very long time. This has been tested on many people. Napakaswerte nga natin, di ba, Dr. Cole? Kasi yung mga treatment regimens natin, hindi yan tinest sa atin, tinest yan sa ibang tao. No? So we're just harvesting the works of many people. So number one, cancer is curable, particularly if you diagnose this early. Pangalawa, cancer, there are resources for cancer, lalo na dito sa Pilipinas, now that we have the law. And I think, siguro lang we have to balance our expectations. Kasi nga, hindi naman pwede lahat ibigay ng gobyerno, right? Health is a shared responsibility. So siguro, if ever we, particularly with living expenses, going back and forth to the hospital for treatment, I think we have to be very patient. So, eto yung mga things na I think kailangan natin. Kasi always yung iniisip natin na una, ayaw natin magpakonsulta kasi takot tayo na cancer. Ang cancer hindi naman mag-aantayan sa'yo kung kailan ka ready pupunta sa doktor, di ba? While you are sitting there, it is multiplying. And the longer that you wait, the bigger it will get. Kakalat siya, mas mahirap siyang gamutin, mas lalaki yung gastos mo. So, these are the things that I think ito yung pinaka-major message siguro namin na, if there is any doubt that it could be cancer, I think you should seek treatment. You should consult a doctor because cancer is curable. Particularly for children, di ba? Aggressive. And that's why we always think of childhood cancer as an emergency. Kasi mas aggressive siya compared to adults. But it's also highly curable. Yung nature niya na malignant siya, sobra, madali siya. It's also, the good thing in it is that it's highly curable. So cancer is highly curable, particularly if you come in early stages of disease.
Okay, maraming salamat po again, Doc May, for answering that question. So I actually have here one last question po for Doc Lily. Doc Lily, question po, can cervical cancer be prevented? And which is na sagot nyo naman po kanina, onting reiteration na lang po. And if so, are there any lifestyle changes daw po na ma-advise nyo para ma-reduce yung risk ng cervical cancer?
Okay, so yes, it can be prevented. No? It is highly preventable. No? So ang hindi ko lang nabanggit kasi I'm more into the cervical cancer screening. There is actually a vaccine. So may HPV vaccine which is very, very effective. But it is most effective in young girls, those without sexual exposures. So itong ibang vaccine na to is also approved for males. The adolescent boys, para before they start their sexual sexual adventure. So pwede pa rin siyang ibigay, Pwede pa rin siyang ibigay among women with sexual exposure, pero yung not doing cervical cancer screening kung nag-vaccine na is not recommended. Kasi hindi natin alam if there is already exposure to the virus. 15 high-risk types yan, So, hindi natin alam kung meron na siya, So, there are HPV DNA testing that would, genotyping ang test na yun, It's quite expensive. It identifies the type of HPV that you have in your cervix, So, most of the time, hindi naman marami yan. So, kung na-expose ka sa isa, so you can still have protection for the others. Kasi lalo na yung most recent, 9 types of HPV yun, Secondly, paano natin siya mape-prevent, that is primary prevention. Ang kasama sa primary prevention aside from vaccination is abstinence, So unless magmamadre tayo, mahirap yata yung abstinence, That's why we are pushing for cervical cancer screening. So if we will look at the patients, pag tinignan mo yung history ng mga pasyente namin, kailan kayo huling na pap smear? Never, Never had a pap smear in their life, So kaya lumalabas na having had no pap smear at all is one of the risk factors for cervical cancer. Kasi hindi na-avail yung screening. And if you remember my slide, mahaba yung natural history niya. Slow growing siya. So, kung hindi man nahuli nung bandang 30s, 35, 45, wala pa, kung magpapascreen kayo, that's the time that it can be detected, So yung treatment for pre-malignant napakasimple, as opposed to magkikimo na radiation pa. So tatanggalin lang part na yun, As kung low grade yun, susunugin lang yun ng yelo o kaya yung thermal ablation, ang dali-dali, The bottom line is please undergo regular cervical cancer screening. And as I said, libre yan sa Jose Reyes up to HPV DNA testing. Until we use up the HPV kits lang. Kasi mahal yung test na yun. So, meron pa. So, kung gusto nyo ma-avail yan, you still have it. At Jose Reyes, punta lang kayo sa onco, no? Gaya ni onco OPD.
Okay, maraming salamat po, Doc Lily. Ayan. So, ayun lang po yung mga katanungan na meron tayo and maraming salamat po sa pagsagot. Mas nalinawan po. Hindi lang po ang publiko, pati rin po ako, nalinawan po ako sa mga bagay-bagay na dapat alam ko patungkol sa cancer. And bago po tayo officially mag-end for our Kapihan session for today, hingi lang po sana ako sa inyo, Doc, ng short key takeaway message nyo po. Or ano po yung gusto nyong sabihin sa publiko regarding po sa National Cancer Awareness Month? Simulan po natin kay Doc May po.
So since February is Cancer Awareness Month, I think we have to be very, hindi lang naman na aware tayo about cancer, right? It's also taking a proactive approach to cancer. Kung hindi man tayo pasyente, siguro we should also support the other activities. Friends from the media has a very important role, particularly in providing the correct information to the public. And this is really crucial with regards to early diagnosis and cure of patients. And for patients na diagnosed ng cancer, you shouldn't lose hope. Kasi ito naman pinagtutulungan-tulungan natin, no? Kaming mga espesyalista, the community, the government, yung mga partners natin both locally and globally are there, no? Hawak-hawak tayo to fight cancer kasi mahirap talaga siya. Hindi siya pwedeng isa lang, no? Hindi pwede pasyente lang, dapat tayo lahat. So yun lang siguro, never lose hope. Cancer is curable, and there are resources that the government provides for cancer, particularly with the Philippine Cancer Law. Yun lang po. Maraming salamat.
Thank you so much po, Doc May. How about you, Doc Lily?
Yes, so madali ako kasi second. I will just say I agree and I second the motion. Yun, ano, so very, very important, no? So, as I said, yung health-seeking behavior, no? Find time. If you love yourself, no? Find time, no? To go to. Hindi porket wala tayong nararamdaman, we are healthy, no? So, this is the time for screening, ano? So, you saw the age group, ano? 30 and above. And especially if you have those risk factors, so you are one of the possible patients who will contract the disease, ano? So, yun lang. So, we offer it free at government hospital at Jose Reyes, no? So, just be patient, no? Kasi maraming patients. Thank you very much.
Thank you so much po, Doc Lily. So, lagi po natin papakatandaan na most cases of cancers can be prevented or treated if detected early. So, regular screening, adopting a healthy lifestyle, and avoiding risk factors gaya po ng pagsusmoke, excessive alcohol consumption, exposure to radiation, and harmful chemicals can significantly reduce the risk po of developing cancer. Muli po, maraming salamat po sa ating mga eksperto, Doc Lily and Doc May, sa pagbabahagi ng inyong panahon po at expertise sa napakahalagang diskusyon po nito tungkol po sa cancer and sa celebration ng National Cancer Awareness Month. So sa ating po mga tagapakinig, lagi po nating aalalahanin na narito rin po ang kagawaran ng kalusugan, hindi lamang po para masigurong healthy ang bawat Pilipino, kundi mabigyan din po kayo ng sapat na kaalaman tungkol sa mga serbisyo at isyong pangkalusugan. Mula noon hanggang ngayon, ang kagawaran po ng kalusugan ay nagpapasalamat rin sa ating po mga media partners na patuloy po na nagiging katuwang namin sa pagpapalaganap ng tamang impormasyong pangkalusugan. Muli po, kasama po si Doc May at si Doc Lily. Ako po si Nino Angelo de Villeres, ang inyong kaagapay na tunay mula sa kagawaran ng kalusugan na nagsasabing, learn, prevent, and screen laban kontra cancer dahil sa bagong Pilipinas, bawat buhay ay mahalaga. Magkita-kita po ulit tayo sa susunod na Kapihan with Media. Maraming salamat po. Thank